day everyone, my name is Andy Alfred, first year college taking a Bachelor of Secondary Education major in Social Studies. On today's video, I am recording my summarization about our topic in Unit 4.
Developmental of the learners at various stage. Topic: Week 10, Prenatal Period. Week 11, Physical Development of Infant and Toddlers. Week 12, Cognitive Development of Infant and Toddlers. Week 10, Topic: Prenatal Period. Prenatal period. The stages of prenatal development. Prenatal development is divided into three periods: germinal, embryonic, and fetal. The first is germinal period, from conception to 2 weeks. Prenatal development that takes place in the first 2 weeks after conception. The second, embryonic period, 2 weeks to 2 months. The zygote will become embryo. Organogenesis is the process of organ formation during the first 2 months of prenatal. Third is fetal period, from about 2 months after conception until 9 months when the infant is born. The motor cords and organ system mature to the point at which life can be sustained outside the womb. As the 3 layers of the embryo form and the support system for the embryo development repeatedly. 3 layers of the cells: endoderm, ectoderm, and mesoderm. Also, the 3 life support system: placenta, umbilical cord, and amnion. Teratology and hazard to prenatal development. Teratology is the field investigating the causes of congenital birth defect. Teratogen is that which caused birth defect. It's come from the Greek word para, means monster. First is prescription and non-prescription drugs. Prescription drugs, thalidomide and antibiotics, can be harmful in the developing fetus. Non-prescription drugs, the mother should be careful from the time of conception anything she intake. The unborn child absorb a paracetamol can also be considered as non-prescription drugs. Second is psychoactive drugs. Pregnant women who drank caffeinated coffee were more likely to have preterm deliveries and a newborn with a lower birth weight compared to their counterparts who did not drink caffeinated coffee. Also, heavy drinking by pregnant women results in the so-called fetal alcohol syndrome or FES. Third is environmental hazard. These include radiation in job site and X-rays, environmental pollutants, toxic wastes, and prolonged exposure to heat saunas and bathtubs. A pregnant woman's core body and temperature will often rise to above 37.8 Celsius when it's normally 37 Celsius. The extra blood not only helps the body meet to the metabolic needs of a growing fetus, but also flows to the other organs like kidneys. For instance, early exposure to lead affects children's mental development. Fourth is maternal factors. A developing fetus depends entirely on its mother nutrition. It is recognized that maternal nutrition during pregnancy may result in the quick growth of the fetus. If a fetus does not receive nourishment, the rate of cell division is seriously hampered. High anxiety and stress in the mother are linked with less than optimal prenatal and birth outcomes. 2 maternal age periods can lead to problems before the offspring development, adolescence and age of 30 plus. 5 is paternal factors that can adversely affect prenatal development include exposure to lead, radiation, certain and petrochemicals. Other fathers may place their offspring at risk for certain defects.
Hi, that's all my summarization of Week 10. So, let's proceed in Week 11.
Week 11, Topic: Physical Development of Infant and Toddlers. Fetal development. Fetal development in just 4 weeks after conception, the neural tube along your baby's back is closing. The baby's brain and spinal cords will develop from the neural tube. The heart and other organs also starting to form structures necessary to the formation of the eyes and ears develop. Cephalocaudal and proximodestral pattern. Cephalocaudal trend is the postnatal growth from the conception to 5 months when the head grows more than the body. The cephalocaudal trend growth that applies to the development of the fetus also applies in the first month after birth. Infants learn to use their upper limbs before their lower limbs. Next is proximodestral trend is the prenatal growth from 5 months to birth when the fetus grows from the inside of the body outwards. This also applies in the first month after birth as shown, followed by that of the hands and fingers. When referring to more development, the proximal trend refers to development of motor skills from the center of the body outwards. Height and weight. It's normal for newborn babies to drop 5 to 10% of their body weight within a couple of weeks of birth. This is due to the baby adjustment to neonatal feeding. Once they adjust to sucking, swallowing, and digesting, they grow rapidly. Breastfed babies are typically heavier than bottle-fed babies through the first 6 months. After 6 months, breastfed babies usually weigh less than bottle-fed babies. In general, an infant length increases by about 30% in the first 5 months. Brain development. Among the most dramatic changes in the brain in the first 2 years of life are the spreading connection of dendrites to each other. Melanation or melanization, the process by which the axons are covered and insulted by layers of fat cells, begins pregnant and continues after birth. The process of melanization increases the speed of which information travels through the nervous system. Motor development. Along this aspect of motor development, infants and toddlers begin reflexes to gross motor skills and fine motor skills. Reflexes is the newborn has some basic reflexes which are of course automatic and serve as survival mechanism. Before they have the opportunity to learn, many reflexes which are present at birth will generally subside within a few months as the baby grows and matures. First reflex, sucking reflex. The sucking reflex is initiated when something touches the roof of an infant's mouth. Infants have a strong sucking reflex which helps to ensure they can latch onto a bottle or breast. Rooting reflex. The rooting reflex is most evident when an infant cheek is struck. The baby responds by turning his or her head in the direction of the touch and opening their mouth for feeding. Gripping reflex. Babies will grasp anything that is placed in their palm. The strength of this grip is strong, and most babies can support their entire weight in their grip. Curling reflex. When the inner sole of the baby foot is struck, the infant responds by curling his or her toes. When the outer sole of a baby foot is struck, the infant will respond by spreading out their toes. Starter or motor reflex. Infants will respond to sudden sounds or movements by throwing their arms and legs out and throwing their heads back. Most infants will usually cry when startled and proceed to pull their limbs back into their bodies. Gallant reflex. The gallant reflex is shown when an infant's middle or lower back is struck next to the spinal cord. The baby will respond by curving his or her body toward the side which is being struck. Tonic reflex. The tonic neck reflex is demonstrated in infants who are placed on their abdomens. Whichever side the child's head is facing, the limbs of that side will straighten while the opposite limbs will curl. Gross motor skills. It is always a source of excitement for parents to witness dramatic changes in the infant's first year of life. The dramatic motor development is shown in babies unable to even lift their head to being able to grab things off the cabinet, to chase the ball, and to walk away from parents. Fine motor skills. Our motor skills are skills that involve a refined use of the small muscles controlling the hand, fingers, and thumb. The development of these skills allows one to be able to complete tasks such as writing, drawing, and botany. The ability to exhibit motor skills involve activities that involve precise eye-hand coordination. The development of reaching and grasping becomes more refined during the first 2 years of life.
So that's all my summarization of week 11. Let's proceed to week 12, the last topic of unit 4.
Week 12. Topic: Cognitive Development of Infants and Toddlers. Sensory motor development. Children go through a period of dramatic growth and learning. As kids interact with their environment, they are continually making new discoveries about how the world works. The sensory motor stage typically takes place within the first 2 years of a child's life. It is marked by the child discovering the difference between themselves and their environment. At that point, they will use their sense to learn things about both themselves and their environment. Object permanence. The term object permanence is used to describe a child's ability to know that objects continue to exist even though they can no longer to be seen or heard. If you have ever played a game of peekaboo with a very young child, then you probably understand how these work. Language and development. Here are just a few of the important things your child might achieve in language development between 3 months and 8 years. 3 to 12 months. In this period, the baby will most likely call and laugh, play with sounds, and begin to communicate with the gesture like waving. Babbling is an important developmental stage during the first year. Babbling is often followed by the jargon phase, where your child might sound like they're talking or having conversation. 12 to 18 months. At this age, children often say their first word with meaning. For example, when your child say dada, your child is actually calling for dad. In the next few months, your child will keep adding more words to their vocabulary. 18 months to 2 years. In your child's second year, their vocabulary has grown and they start to put two words together into short sentences. Your child will understand much of what you say and you can understand what your child say to you most of the time. Language development vary hugely, but if the child doesn't have some words by around 18 months, talk to your GP or child and family health nurse or another health professional. Domain: language, pre-reading, and pre-math. Language: receptive language. 0 to 6 months. Watches primary caregiver intently as they speak to him or her. 7 to 12 months. Understands no. Point to family member when asked to do so. 13 to 18 months. Point to 5 body parts on him, herself when asked to do so. Follows one-step instruction without need to gesture. 19 to 24 months. Points to 5 name pictures and objects when she asks to do so. Language, expressive language. The child is able to use word and gesture to express his thoughts and feelings. 0 to 6 months. Makes gurgling, cooling, bubbling, or other evocal sounds. Use gestures to indicate what she wants. 7 to 12 months. Repeat sounds produced by others. Says meaningful words like papa, mama to refer to a specific person. Uses animal sounds to identify objects, events in the environment. 13 to 18 weeks months. Speak in single words. Say yes and no appropriately. Uses word accompanied by gesture to indicate what she wants. Respond to simple question with no with single. 19 to 24 months. Uses possessive pronouns. Say what she wants without accompanying the gesture, attempts to converse even if he cannot clearly understand. Pair reading and pre-matching. The child is able to match identical objects, colors, shapes, and symbols. 7 to 12 months, able to match identical object. 19 to 24 months, matches identical objects, matches identical pictures. Higher order mental abilities, concept formation. The child develops basic concepts pertaining to object constantly, space, time, quantity, etc., and uses these as the basis for understanding how materials are categorized in his or her environment. 0 to 6 months. Experiment with new objects or toys by banging or putting them in his mouth. 7 to 12 months. Look for partially hidden object. 13 to 18 months. Can tell whether something is hot or cold and hands over one object when asked. 19 to 24 months. Can tell which is shorter of 2 minutes. Can tell which is taller and longer of two items. Higher order mental abilities, the child is able to understand the cause-effect relationship. 90 to 24 months. Enjoys constructing objects or structures out of manipulated toys. Uses toys or objects or symbols in play. Cause